Hi, today I'm going to be talking about hypothyroidism. Hypothyroidism is a disease of the thyroid gland, and it causes a decrease in secretion of hormones T4 and T3 and an increase of TSH secretion. The most common cause of this disease is an autoimmune disorder called chronic thyroiditis, or also known as Hashimoto's disease. Nutrition can also affect the function of the thyroid gland. Iodine is an element that our bodies don't produce, but it's absorbed from food. It is absorbed through the bowel and carried through the bloodstream to the thyroid, which then synthesizes the production of T3 and T4. Iodine-deficient diets will lead to a decrease in production of T3 and T4 and a compensatory response of an increased TSH secretion. The pathophysiology involved with hypothyroidism will discuss the thyroid hormones. T3 and T4 are the two thyroid hormones that are secreted by the thyroid gland, and they are secreted in a response to the secretion of TSH, which comes from the hypothalamus and pituitary glands. These hormones play a major role in controlling the metabolic rate of the heart, digestive tract, and bone development. The thyroid gland, pituitary gland, and hypothalamus glands all work together to determine the amount of hormones that should be released into the bloodstream. Thyrotropin-releasing hormone, or TRH, is distributed through the hypothalamus, and it stimulates TSH secretion from the pituitary gland. The amount of TSH in the blood will then determine how much T3 and T4 hormones are produced from the thyroid. In Hashimoto's disease, the body produces antibodies against one or more of the thyroid antigens, as well as thyroid-specific B and T cells that then infiltrate the thyroid, causing a loss of its function. The interruption of hormone regulation will then lead to a slowing of the metabolic processes. Patients will notice weight gain, lethargy, and bradycardia. A rare but life-threatening complication of severe hypothyroidism is myxedema coma, which causes a decrease in mental status, hypothermia, and slowing of the function of the major organs. Risk factors that are associated with Hashimoto's disease: it affects 10% of the population, more women than men, and it increases its prevalence with age. There is a genetic susceptibility to Hashimoto's thyroiditis and an increased frequency in patients with Down syndrome and Turner syndrome. So major signs and symptoms include a slowing of metabolism throughout the body, including the cardiovascular system. So that causes a decrease in blood flow, which will lead to pale and cool skin. Other changes in skin include hair loss and brittle nails. Patients may complain of shortness of breath, and that's particularly noted during exercise due to the decreased cardiac output. Shortness of breath and hypoventilation is also due to impaired respiratory function and respiratory muscle weakness. The slowing of metabolism also decreases the gut motility, and patients will complain of constipation. And in severe hypothyroidism, they may have non-pitting edema of the face and thickening of the tongue, and that's called myxedema, which is showed here. This picture that I chose shows myxedema. It shows the periorbital edema, puffy, dull face with dry skin, lateral thin eyebrows, and coarse, dry hair. To diagnose hypothyroidism, providers will order labs, and the blood will show elevated levels of serum TSH and low levels of serum-free T4. Then to identify the cause of the hypothyroidism, antibody levels can be drawn. Patients with Hashimoto's thyroiditis will have high concentrations of antibodies to thyroid peroxidase and thyroglobulin. To treat hypothyroidism, the patients will need hormone replacement therapy. A daily oral dose of synthetic thyroxine, which is T4, is usually recommended, and those patients will often be on levothyroxine, or Synthroid is the common medication that's prescribed. And that's what I've learned about hypothyroidism. I hope you've learned something today too. Thank you.